Hi, everyone. Thank you so much for coming. I want to introduce our paramedic, Mr. Gordon Lee, as well as our optometrist, Dr. Samantha Chan.
Hello, everyone. How's it going? Good. So my name is Gordon. Um, I am I've been a paramedic for the last 8 years with Toronto Paramedic Services. So I worked in the downtown core and in the Leslieville area in my first 6 years of my career. You want me? Sorry. So during that time, I responded to 911 calls in an ambulance. And then in 2019, I became a field training officer. So that involves me going to teach college students after they finish their in-class portion, and then getting them through their ambulance like hands-on portion of the curriculum. That's where I taught them while they on a 911 call how to do assessments, how to provide treatments. And then the last 2 years, I worked in the community paramedicine department with the service. This is when I reach out to seniors and individuals with chronic diseases, and then I go provide medical assessments and home care in their own home. Personally, I am married. I have a new baby at home. It's quite tiring, and I also have a golden doodle at home. I like going out for a run on my free time and playing golf. Yeah, so I'm gonna be here to talk about paramedics to everyone. Is anyone here a high school student? Just curious. High school students? High school? Is there anyone in the undergrad, like in their like? Awesome. Okay, cool. Just wondering who I'm speaking with. So, what do paramedics do? So we respond to medical emergencies. We're the first point of care on any kind of medical emergencies. We respond to calls like heart attacks, strokes, cardiac arrests, overdoses. We also do traumatic calls like car accidents, shootings, stabbings, fire, burns, all the things like that. We also assist with people that might have fallen or just feeling generally unwell. We also deal with people that are probably might be having a mental health crisis. We respond to calls 24 hours a day, 365 days a year. So it's nonstop. We perform assessments in any kind of environment and any kind of places. We also provide treatment in any kind of places that will require us to go. So for example, of a call that we do, we might get call for a chest pain call where someone's having chest pain, they call 911, then we get dispatched and we go to their home. Then we can take history of the patient. We'll do a very extensive electrocardiogram of their heart. Then we determine if they're having a heart attack or not. And then if they are, we can give them treatment like medication or a comfort measure. And then we'll take them to the right hospital, where usually there's a cardiac center where you can do the catheterization lab and then do a procedure where they can stop the heart attack and then prevent from any other injuries happening. So that's what we do. It's a little more than just driving an ambulance, I guess. So we work in shifts. So our shifts are normally 12 hours long. We work 24 hours a day. We work usually in pairs. So when we usually arrive for our shift, there's always another crew that's staffing that ambulance. We'll take over for that crew. And then we will disinfect and clean every equipment that there is in the equipment in the truck. And then we'll look for anything that's missing or that's malfunctioning. Some of our equipment that we have to inspect include a cardiac monitor, an oxygen bag, drug bags, trauma bags. We also have the stretcher, a device to help us get people down the stairs. We also have backboards and scoop stretchers that help people get down tricky terrains. So we have to inspect all the extrication devices that we have and make sure they're in working order. And then when a call comes in through our dispatch, we get sent to the address, we drive there, and then we perform our assessments, provide treatment, and determine if they have require any kind of hospital intervention. And then we'll drive them to the hospital. And then we give the nurses there and the emergency room a report, and then they take over care. And after that, we clean everything and disinfect everything again, and then the cycle starts again, and we do this for 12 hours. You can do anywhere from 4 to 10 calls a day, depending on the service you work for. And then at the end of the shift, we go back to our station, and then another crew takes over for our ambulance. So what is the education like? It is a 2-year college diploma. You can go right out of the high school if you like, but a lot of us do have some kind of post-secondary education. 2 of the colleges in Toronto that offer paramedicine is Humber College and Centennial College. Because this is a very extensive and it's a very challenging program to be in. Like I said, a lot of us have undergrad degrees that's before we go into paramedicine. It's not like any other college program. You learn a lot in those 2 years. You have to study anatomy, physiology, and all the practical knowledge in providing emergency medicine. At the same time, you get into a hospital placements where you learn different departments in the hospital to see how they operate. And also within those 2 years, you have to be on a ride out. So like with a preceptor crew like me, you go out in the ambulance, you work for at least 450 hours while you're still in school, and to acquire practical knowledge. After you finish your college degree, part, you have to get your F-class driver's license, which is a little more than your G-class. You also have to do a licensing exam, which is in Ontario called AMCA. And then there's also a lifting requirements. So most service, before they hire you, they need to test your lifting. That means usually a 220-pound lift with a partner with different extrication devices. So with a stretcher or a stair chair that we use, or a scoop stretcher, things like that. And then once you're hired, you go through something called base hospital testing. So with us, even though I'm employed by the city of Toronto, I work under a license of a doctor who's at Sunnybrook. So we get tested by the hospital Sunnybrook to make sure we know our medication that we give, the life-saving treatment that we do. We get tested by that doctor so that we can use under his license. So some of the courses you might need in high school to get into paramedics will be English, math, and then your biology and chemistry is your minimum requirement. So what is our scope of practice? So like I said, we work under a license of a doctor. So they have standing orders, which is orders that are given by the doctor that allow us to give medication or perform life-saving procedures. So those medications are, depending on what care of paramedic you are, carry different kind of medications. So there's 3 cares of medication in paramedics in Ontario. There's primary care, advanced care, and critical care. And when you graduate from college and get hired by a service, you start off as a primary care paramedic. So primary care paramedics, we carry 17 symptom relief drugs, and we perform 10 controlled acts, which is the standing orders that help life-saving procedures. So those are listed there. So some of the medication you can see is like epi for allergic reaction. We might have pain medication like ketorolac. We have nitroglycerin for people having a heart attack. We have your Ventolin puffers for people having asthma attacks. And then some of the controlled acts or the life-saving procedures that we do, we can do advanced airway insertion. So some of the examples are like adjuncts like NPA or OPA. We also do deep suctioning, so we can go all the way into the airways to suction if someone is having a airway obstruction. We do defib. We do taser probe removal. So we do taser calls. So when the police have to tase somebody, they have to remove the prong. So we have standing orders to do that as well. We also have capability to start IVs, so we can give intravenous fluids and medications through the IV as some of our practice. Then as you become better as a paramedic, you go through more school, then you become an advanced care paramedic. They have a lot more medications. They carry about 30 medications. Some of the medications include, I don't know if you can see in there, but there's antibiotics, there's adenosine, amiodarone, atropine, morphine. They do fentanyl, So a lot of medications are for cardiac arrest. So when the heart stops, they have medications to restart the heart. They have medication for pain relief and also sedation. So like your midazolam, which is used for sedation. So if people are combative, we might use those medications to sedate them. They also have medication to treat irregular heartbeats and like raise blood pressures. They have skills and they have more controlled acts that they're allowed to do, like life-saving procedures. So some of the interesting ones are like they can do needle chest decompression. So if someone's having a what's it called? When their chest has air in it and that they can't breathe, they do needle chest decompression to help relieve the pressure in their chest. They can also do intubation on field, so they can intubate and help people breathe. So they're helping stick a tube in their mouth so that they can breathe for them on the field. And then there's critical care paramedics. Their scope of practice is very wide and varies depending on the service. Those are the guys in your orange ambulance and your helicopters. They do critical transports for people from one hospital to another that are very sick. But their scope of practice varies depending on where they work. So in Toronto, there's a lot of different special team paramedics as well. So one of them would be a critical care transport. So they're your critical care paramedics. They take people from one hospital to another. They're very sick. They might require sedation. They might require a machine to help their heart circulate. So they're on those machines and they transport them from one hospital to another. They have your tactical paramedics. So they work with the emergency task force of the police. So your SWAT teams, they get embedded within the team and then they go do calls with them. So they respond to calls like hostage situation or someone threatening to go commit suicide. So there are special calls that they go to that are a dangerous environment. So they will go to those calls with police. Public safety unit is another team that gets embedded with the police, with the public safety unit. Their training is in riot control and crowd control. So for example, there might be a gigantic protest happening downtown, and those guys might go in and be embedded with the police unit and protect the police and also the crowd and provide any medical treatment within those situations. And then the next one's called CBRNE. That stands for chemical, biological, radiological, nuclear, and explosives. So there are your chemical exposures, people were suffering from burns or a nuclear accident, they get called, they have medication and special training and special PPE for them to go into those calls to reverse something that could happen for those patients. You have your bike medics. So bike medics go to events that like your CNEs, your pride parades, your caravana that cars cannot actually get into. So they respond to medical calls within those special events. Then you have your emergency support unit. So they're the ones in the buses on the very right there. So we actually have a couple of ambulance buses within our service. So they respond to mass casualty events. So something like a condo building that's on fire, they might get sent to it. So there might be a lot of patients. They can treat a lot of patients within a single ambulance. And then you have your ACTS team. That stands for Acute Care Transport Service that works with the sick kids team. So they're embedded with the sick kids hospital and they go take very sick children from one hospital to sick kids. So they have special equipment and training to treat pediatrics. And then you have community paramedics. So that's what I do. And I'll give you guys a little explaining of what community paramedics do in the next slide. So we're a specialized training and specialized skilled paramedic that's focused in patient education, advocacy, and we also like to match each patient's unique needs to the appropriate care through a focus of health promotion and injury promotion. The program focuses on clients that are at risk of recurrent medical emergencies, so that we have frequent 911 calls or the frequent emergency department visits. So that's what we focus on. It's a very new field and it's evolving, expanding every single day. We try to help identify and address people that with gaps of home healthcare, and we'll give them social supports as well. We'll help them navigate through different healthcare systems. We also help them connect to different resources to improve their quality of life. We work with partner agencies like police or social workers or fire department or pharmacies to make sure they have the proper care and to help augment their service as well. So some examples of what we do. During COVID, we actually had our buses go out to at-risk communities, and we did mobile COVID testing. So we did COVID swabs for people that are feeling they're sick or thinking that they may have exposed. We did like mobile COVID testing. We also do mobile COVID vaccines and flu vaccines where someone might be homebound or they can't go to a clinic to get their vaccine. So we'll go do homebound clinics for vaccines as well. We do home assessments and we provide home care for people with chronic diseases. We also have a street outreach program. So we do harm reduction for people that are unhoused and that might be at risk of overdosing. So paramedics is a new community paramedics is a new field and is expanding, and some of the other services in Ontario might be doing things like blood work at home. They might be providing palliative care, which is like end of life care for individuals. They also do mental health support, mental health outreach for people. So yeah, like our field is just expanding every single day, which is quite fascinating. So with what I talked about for the last 5-10 minutes, let's talk about if paramedics would be something interested in a career that you want to go into. So paramedics have attributes that work in different challenges every day. You need to be able to problem solve very quickly. You need to be able to work independently and also in a team setting. It is a very dynamic work situation, so we get different calls. You never know what you're going into every single day. So you need to be able to be flexible in what you're thinking and how you're able to do calls. It's a stressful job for sure. You're getting called to when someone's at their most stressful situation, right? When someone called 911, they're stressed, they're uncomfortable, they're looking for help. So you're there to provide comfort, compassion, and medical advice, right? So it is a stressful job. There is a physical aspect as well. You need to be physically fit for this job because there's lifting. You need to maybe climb up a long flight of stairs to go to certain calls. So there's a physical aspect to this job. You need to be physically fit. But with that said, the prospect of being a paramedic in Ontario is actually very, very good. In 2023, I know that in Toronto Paramedic Service is hiring 250 paramedics by itself. There's also other services like Peel, York Region, Durham, all around the GPA are hiring a lot of paramedics. And next year, we're going to add another 80 new positions on top of attrition. So they're probably looking to hire another 250 paramedics. So the job prospect is really good. And we're getting a lot of funding from the province. So our scope of practice is going to expand. It's a very exciting career to be going into now because our job is going to expand dramatically. Our job currently this year, our hourly rate is between $40.50 and $44.50 in Toronto. That range is because of how many years of service you have. So it goes up as you work more years as a paramedic. So yeah, so that's my presentation on becoming a paramedic and what it's like to be a paramedic. It is a very interesting job and it's very different. I really enjoy it. You get to be in some very unique situations. There's definitely lots of perks about the job. Like you get to go to unique events. Like this week, I actually worked the Maple Leaf game in Scotiabank Theater or arena downtown. I was a medical crew there. So you get to go to some very interesting places. I worked the Pride Parade. I worked Caravana. It's actually an interesting place, and there's a lot of perks with this job, even though it's quite stressful and quite demanding. Yeah, if you have any questions, that's my email address. You can feel free to email me with any questions, and I will get back to you guys. Thank you for your time.
Okay, hi everyone. Sorry I didn't make a PowerPoint, so I guess you're just gonna have to listen to me. My name is Samantha. I'm an optometrist new grad. My presentation's just mostly gonna be about my journey, why I chose optometry, my optometry school journey, and where I'm at today. So it started when I was really young, probably about 8 years old. I knew I wanted to be a doctor, and I'm sure most of you have a heavy influence from your parents that want you to be doctors as well. So I knew I wanted to be a doctor, but I didn't know what kind of doctor because as a kid, I was absolutely terrified of doctors. So it was up until my first eye exam with my optometrist that I was nervous, but they made me feel so comfortable and I didn't need any glasses or anything. So it was a very great experience for me. And that's what really piqued my interest. And from there, I focused on sciences. So in high school, I was in all the science courses, and then I actually went to Laurier for biology for the beginning. So for my first 2 years, I was majoring in biology. And after those 2 years, I really started to look at the prerequisites that I needed for optometry school. And the prerequisites I needed didn't align with my biology schedule because there was a lot of biology credits I needed to take. So I switched over to general sciences. That could fit more like English, math, and physics, and all those other things I needed for optometry school. So I graduated after 4 years with my general science. And just a fun fact, you actually don't need your bachelor's degree to apply to optometry school. You could actually finish it in about 3 years. And then a lot of my classmates actually did that, but I didn't. I did the full 4 years, graduated, and then I decided to take a year off just so I could work within the field, just to make sure that that was something I actually really enjoyed. So I worked at a LensCrafters optometry clinic as an office manager full-time for the year, and I really liked it. So I made really great connections with the doctors there, and they're actually my references to the school. And I actually also wrote my OAT. So that's the optometry's admissions test, kind of like an MCAT for medical school. So after writing that, I decided to apply to schools only in the States. So in Canada, there's only one English-speaking optometry school, which is Waterloo, and it is very competitive. So I'm not saying you can't do it, but I decided not to. So I only applied within the States. And I first heard back from a school in Puerto Rico. It's a territory of the United States, and I accepted. So there are a few reasons I wanted Puerto Rico was first because of the weather, of course. I wanted to live in the Caribbean weather. Secondly, it gave me the chance to learn Spanish, and I knew that would be a competitive edge on my resume after graduating. Thirdly, the demographics. You see a lot more in that type of demographic with the patients than you would see somewhere compared to Canada that has a very good healthcare system. So you see a lot more diseases and pathology. So I went to optometry school. It is 4 years. My first 2 years, it was very academic heavy. We had multiple tests and assignments every week. It was very straining. But in third years, when you actually start seeing patients yourself, and that kind of gives you a taste of what your career is going to be like. And that's when I started falling more in love with optometry in general. Fourth year was just clinics. So you're working pretty much 8 to 5, and then you go home and you have to study all night long because you have your board's licensing exams in fourth year. And those are pretty strenuous. The American one is 3 tests long. So the 2 written tests are 8 hours each. And the third test is a practical test where they kind of test you on your capabilities in clinic and how well you speak to the patients, kind of like patient care and your empathy towards them, making sure that they can trust you as a doctor. So after you pass all that, I graduated last year of June of 2022. Actually, I'm going to talk about fourth year a little bit more. So my fourth year is all rotations. So my first semester, I did it on island in Puerto Rico, all around the island with different clinics, and I shadowed a lot of specialists that were in like contact lenses, pediatrics, low vision, prosthetics, and you kind of get a feel of what your clinical interest will be in. And second semester, I was supposed to go back to the States to do my rotations, but because of COVID, there was a lot of clinical restrictions. So I decided to find one back in Canada. And by that time, I was very homesick. So I was happy to be back. I did it in the GTA, and I graduated in June of 2022, and I'm still working in the GTA till now. And then I'm going to backtrack a little bit. In 2020, my mom and I, she's in the front row, Judy, She has a very strong business background, so I'm very fortunate about that. And we decided to look into purchasing a clinic that is a best fit for us. So we actually found one in East Gwillimbury. That was our first purchase. And then our second one was a year later in Midtown at Yonge and Eglinton. It's called Sight Care Optometry if you ever want to visit. But that's where I'm working at today full time. And yeah, so optometry, I'll end off talking a little bit about optometry in general. It is a very fulfilling career. Honestly, I thought I was going to only be studying eyeballs for 4 years straight, but I went past that. You pretty much have to learn about the whole body. You can see diseases in the eye, such as diabetes, hypertension, any heart diseases, even brain tumors. I had patients come in and they didn't even know they had these. So you're the first line of care that actually sees it. And I would have to refer out appropriately to a specialist so that they can get proper care. And yeah, it was a very hard journey, mentally, emotionally, and physically, because I had to travel a lot, but it was so well worth it. And if you're interested, you can definitely contact me. I can give out my business card for the contact information. And yeah, if you have any questions for me, that would be great. Let's start.
I would like to open up the floor to a Q&A. So if you have any questions for Dr. Samantha Chan or for Mr. Gordon Lee, please feel free to ask them.
You have a question? And yes.
Ask a question. So basically, you study in a foreign country, right? So how much of the tuition fees, how you pay for that?
That's a good question. It was definitely a higher tuition fee, and you don't get financial aid because you're from Canada. So you would have to get a private loan back in Canada for that. Yeah. And if you're curious, it was pretty high. It was probably, I think it was about 30 grand US a year. Correct me if I'm wrong, Janine, but yeah, it was 75. Sorry, she said. It was definitely higher. But I mean, after you start working, it is pretty well worth it. It's a good salary once you start, especially if you're working like 6 days a week, which I am, to pay it off. And you also do get OSAP as well. It's not a lot, but you can still apply, which helps. Yeah. Yeah. Any other questions? Yeah.
I have a question regarding paramedicine.
Yeah.
So what studies do you want to go into if you want to pursue that line of career?
Question. So like for high school, you just need very minimum like math, English, your biology and chemistry. A lot of us have undergrads, so a lot of them will do like health sciences or life sciences. I have a background in kinesiology. You don't have to. You can go straight into high school. There's paramedics out there have a high school diploma and one just call it. I would look into first aid, look into doing a lot of first aid stuff, and maybe getting an emergency first responder just to get your practical knowledge in how to do first aid. So that's something I will look into. Mhm. Go ahead. Yeah.
That's a really specific question about like you said that you're always like paired with partners.
Yes.
Are you always paired with like the same partners who become friends with them, or is it always like a different one?
Yeah.
So mentioned there's like multiple types. They always they're like I don't remember.
Caravan scared. So it depends on your seniority. So our job is union based, so there's a seniority. Once you have a certain amount of years, you can bid into certain stations that you want to work with or partners that you want to work with. When you start out as a paramedic, you fill in for spots that are missing. So someone might have called in sick, or there's an ambulance that's not staffed. You get filled in. So you work with a different partner every day in the beginning. But as you work longer as a paramedic, you become you bid into stations or partnerships. Then you have become having a permanent partner. In Toronto, they partner advanced care with advanced care and primary care with primary care. Doesn't mean that I don't work with advanced care. Sometimes we can. It's not like you cannot. But in Toronto, they like to pair those ambulances together like that. In York Region, they like to put advanced care with a primary care paramedics, just different configurations of ambulances. Critical care paramedics only work with critical care paramedics though. So they have their scope of practice is so wide that for advanced care or paramedic care, they just cannot work together, or usually don't.
Are like the different ones, but then when administer like other stuff,
Yeah.
they have to be like dispatched for specific cases.
It's true. That's a good point too. But when you have a very sick patient, like a cardiac arrest, when you have one advanced care by himself, there's a lot to do. So they have to intubate, they have to start the line and the IV line, they have to give fluids, they also have to look at the airway. So there's a lot of things going on for one paramedic. So they like having two together so they can do different tasks working together. On a very sick person call, usually more than one ambulance will be dispatched to those calls. Mhm. Any other questions? Oh, yes.
Is there a difference in workload between primary care and advanced care?
What do you mean by workload? Like how many calls you get, or how difficult the calls are, or both? Not really. It's busy no matter what kind of paramedic you are. In Toronto, your closest ambulance gets sent to your call. So it doesn't really matter if you're advanced care or paramedic. They don't really look at that. Your closest car, if you're the closest ambulance to that call, you get called anyways. So the workload is the same. You just do different things. Your scope of practice is different. You might be, as a primary care paramedic, there might be someone that has a very low blood pressure that I don't have the medication for, that I can call an advanced care over to help me give that medication. Something like that. It's a good question. Pardon? Yeah, we work shifts. So we work, how long? 12 hours. There's 12-hour shifts. I usually say it's minimum of 12 hours, because then at 12 hours, if you still have a patient, you get dispatched to a call, it's not over. You have to stay till you finish that call. So some shifts are like 13 hours long, 14, 15. I've done an 18-hour shift. So they can be very, very long. But most service work in 12-hour shifts, minimum. Any other questions? Okay. Oh,
I have a question for optometry.
Yeah, of course.
So you mentioned that there's only like one that's like English in Canada. Is there any like one?
There's a French one. I believe it's in Montreal. Yeah. So there's just the two in Canada.
You need a very high GPA in order to.
Honestly, not too high. I think mine from Laurier was probably, it was a different scale. They rated out of 12, but I think it was about 3.6. But honestly, what I was told now that they actually look at your experience more and your interview. So they look at how much you've worked within the field and also your volunteering experience and work experience and like that. And then once you get to the interview, they ask you a series of questions, just more about yourself. And that's what it's heavily based on. Yeah. And your OAT scores as well is okay. Any other question? Yeah.
Question for Cheung.
Mhm.
So can you do the eye surgery?
So in Canada, you can't. I know in some states, they're starting to allow optometry to do some like LASIK work. But in Canada right now, the scope of practice, there's no surgery, but we could prescribe certain medications to treat other conditions like glaucoma and other things like that. And we also do the post-op. So after you had cataract surgery, we can follow up with you. Anything else?
Right.
Yeah. Oh, I think that's
Was
for
that
you.
for me or for her?
Oh, for
you.
me? It depends with what your contract is. I mean, optometry, you can really make your own hours. For me, because I own my own business, I want to be there as often as I can. So our hours are about 11 to 6. But really, other people, you can just make your own hours. Like if you're interviewing with other clinics, I know my friend works from like 8 to 2 sometimes. It just really depends on what your contract is, but it's very flexible.
Yes.
People with mental disabilities, like anxiety, be able to join paramedics?
For sure, 100%. Yeah, 100%. Yeah, simple answer is yes.
If like I have a panic attack during it, that wouldn't be really responsible.
No, but if you have just a diagnosed anxiety, no problem, right? Like, but people have panic attacks all the time, right? I can't discriminate based on that. So for sure, you definitely is able to. No problem.
For optometry,
Mhm.
if you don't own your own clinic.
Yeah.
Let's say you're working with lens grafting,
Okay.
how much can you make? in a day?
So what I was told about the average, so it depends, there's many different routes you can go with the salary. Sometimes they say like a 25% of gross, so your eye exam and their sales. And just to give you an estimate, eye exams are going for about 120 is the average for a full eye exam for insurance. OHIP is a different story, but you'll get a percentage of that. So that's one way, or you can say something like 60-40, so you get 60% of the eye exams and then maybe some commission from the optical portion as well. So it depends on that, but yeah, if you're working for another optometrist, they usually take a cut from your fees, from what I understand. Mhm.
The last question for Dr. Cheung.
Yes.
So how many years you spent the study?
Oh my gosh, a long time. So 4 years of undergrad and I took the year off and then 4 years of optometry school. And you could continue by doing residency for about, I think it's 2 years for optometry. So specializing in a field that you're interested in. But I was very over school at that point. Yeah, so 8 years total after high school. Mhm.
So after high school, you study 4 years undergraduate.
Yes,
degree.
yeah.
It has to be a science degree.
It doesn't. So it could be, I mentioned it before, like you could just do the prerequisites. I know some people were in engineering. I think one of my classmates was in business. Yeah, but they just did all the prerequisites they needed. So it's like, you can search it up. Each school is a little bit different, but it's mainly just English, math, physics, bio and chem. You just have to have like I guess like the first few years of those courses. It doesn't have to be advanced, like a 4th-year course. Mhm.
But you also have to take the OAT. right?
Yes, and the OAT is kind of similar to the MCAT.
So I
Yeah.
have no idea what is OAT.
OAT is the optometry admissions test. So it's like a MCAT for a medical school. It's just a general test. I think it was about 5 hours long that you study for. And then you write the test and you get a score and there's an average score. I don't remember what it was, but based on this, they kind of rank you about how, I guess like a IQ type of test. And yeah, if you score higher, it's more competitive.
I think every year they have a cutoff point, right?
Yeah, yeah,
So every year.
yeah, it is.
Sounds very challenging.
It is challenging, but very worth it.
I think there's a lot of misunderstanding about optometrists, right?
Yeah,
Because in Hong Kong, the system is different,
it is. Yeah, even in UK as
Yeah.
well, everywhere.
but in Canada, like it's a doctor.
It's a doctorate. In the States, it's a doctorate as well. But yeah, I think UK, it's just a bachelor's degree.
Yeah.
And a lot of people, there is a route of going to UK to study optometry school, but then coming back to Canada, I think you have to do a 2-year program at Waterloo. So you could do that as well, but it's a lot longer.
I think the main problem is like in Hong Kong, the optometry school doesn't have medical school
Yeah.
connected to it.
Hmm.
So they're missing the medical part of
Yeah,
the program.
yeah,
So that's very important. Like, that's why we call it doctor here.
Yeah.
Because they can really like do some simple things, right?
Yeah.
Simple thing for the eye or.
yeah,
They
for
can
sure.
prescribe drugs, right?
yeah. It goes past just refracting. You can diagnose diseases and everything.
Yeah, sometimes we have to clear the misunderstanding.
I know. Yeah, definitely. I agree with
Yeah,
that.
because a lot of people still call the optometrist in Gongxi, right? But-
Yeah, yeah,
But actually it's an eye doctor in
Mhm.
Canada.
yeah.
There are many confusion, like in many Chinese mall like first market.
Yes.
There are so many like optical center
Yeah,
and they have a person there supposedly do the eye exam for you, but
Yeah.
you doubt if any
Yeah,
of us
Yeah.
actually doctor.
Sometimes it's mostly opticians doing refractions, but they can't diagnose any diseases. They can't prescribe any drugs. I don't know if they're,
But
what
they
their
still
license
have
requires.
a Prescription.
Yeah. Yeah. Yeah, just be careful with those. I know some of them were doing contact lenses too.
Yeah, allowed
Yeah,
to.
Yeah, I don't think that's a part of their licensing. Yeah,
Those are probably opticians.
yeah. Because even the optician we work with, she doesn't do that. I would have to see them and then transition it to her to sell the glasses.
So is it supposedly if they call themselves optometrists, they have to be a doctor? in
They have
order
to be
do that?
licensed, yes. Yeah.
And supposedly you will have to pay, like
Mm-hmm,
either you have to be a really young, in order to be covered by audit.
mm-hmm,
Or
yeah,
maybe senior
Yeah.
covered by audit, but otherwise you need to pay.
yeah, by insurance usually, yeah. Yeah.
So if those are free, then they are not legit.
Yeah, I would be skeptical of that.
Actually, I think it's important to have the eye checkup too.
It is,
Because
yeah.
a lot of the disease. like,
Yeah.
You can see from the eye first.
Exactly, and they're silent as well, like, a lot of my patients didn't know glaucoma's silent, they didn't know they had it until I noticed some changes and would have to refer to ophthalmologist, but yeah, that's a good point.
So, and more
Mhm.
questions? Okay, so thank you
Yeah,
very much.
thank you. Oh, pardon me.
Oh, thank you.
Thank you.
Thank you, thank you.
Maybe you can take
Oh,
a photo.
Sure, let me fill this away.
Oh, we have a photographer here.
Oh,
No visual. Okay, so.
Thanks, guys.
Thank you.
Then we'll group together.
Yeah.
Oh, you want to do it together?
Oh, yeah.
Yeah, closer, together.
Then that's it.
Okay, great.
Great, thanks.
Yeah, thank you. Thank you.
Everyone.
Yeah, thank you, everyone. Remember to fill in your survey form. You really need to know like how to do it and how to do for our next. Hopefully, we may have one before, but that may not be a healthcare.